Musculoskeletal pain may be fairly obvious, but essentially that refers to any pain in muscles, bones, ligaments, tendons, and nerves. It can affect one area of your body, or it can be like your entire system. And we'll sort of talk about some of the discriminations there and things that one can do about that and reasons why that pain can begin in the first place. When we assess pain, it's important to recognize that not always will we experience overt clinical signs that a person's in pain. You can in many cases, but a lot of times you can't. So a lot of it is, how do you create a relationship with an individual that you might want to help assist them with their pain relief? How do you know what's real, what's not real, and how do you get to the place where you understand the pain and maybe the cause of the pain, and maybe you can help them understand that as well. And so later the term biotensegrity was coined to basically talk about the ways in which muscles, tendons, fascia provide a continuous pull on the bones, which then allow the bones to float and really not physically have to touch each other. There's always a ligamentous or a cartilaginous interface between those particular bones, and that the all 186 joints in the spine are involved in just about every movement that we make. If you've ever had, say, something like low back pain, and you have to do something as rudimentary as just go to the bathroom, you realize that, wow, even the slightest movement will strike a huge amount of pain in somebody. So there is a continuum of trauma and pain that moves from physical distress and moves into mental and emotional distress. And so to hurt is emotionally and mentally painful. Often mental and emotional distress, that is to be in a stressful circumstance, a painful circumstance, that also can translate back to physical distress. So there is this continuum that goes back and forth. Everybody reacts differently to particular traumas based upon some genetic predisposition, their personal history, whether they have like a PTSD related to something similar or not, the properties of the involved tissues, the degrees of reactivity that we have psychologically, how conditioned we might be. It's not uncommon for us to see people who are, say, middle-aged, let's say 45, 50 years old, and they've been working for the last 4 years in an office job that's left them very little time to exercise. And now they feel really overweight and unconditioned. So they decide, you know what, it's January 1st, I'm going to go get me a gym membership. They go to the gym, and the first thing they do is they pull a muscle. They pull a hamstring or whatever it is they do because they haven't been doing anything. So they jump into it. And now the injury might take 4 weeks to heal altogether. And so now they're 4 more weeks out of the gym. Kratom. Kratom is a relatively controversial agent at this point in time. You can still buy it in the United States. I think the FDA would like to take it off the market. I think it's a very useful plant. The interesting thing about it is that it's a very humongous tree, and you eat the leaves on the tree. So grow the tree, buy the tree and grow the tree, because most people who are looking into these things, they don't know an elm from a kratom. It turns out that Oakland, California, one of the primary landscape trees there on the terraces of Oakland is Eleutherococcus peregrina, which is the source of yopo snuff.